In this video, we discuss the idea the supplemental ketones in and of themselves can be anti-cancer. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101 – Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Previously, the primary reason for the anti-cancer effects of the low-carb or ketogenic diet profiled in a previous video was thought to be the decrease in blood glucose that it causes. However, new information has come out indicating that ketones are in and of themselves anti-cancer. Ketone bodies have been found to inhibit glycolysis, thereby decreasing the main energy production pathway of cancer. Ketone bodies are also transported into the cell via the monocarboxylate transporters, MCTs, which transport lactate out of the cell. Cancer produces an abundance of lactate, and expelling it is of critical importance to the cancer's survival. By competing for these transporters, ketone bodies may be inhibiting cancer. A mouse trial in 1979 actually demonstrated that exogenous ketone supplementation was able to reduce the number of melanoma metastases to the lungs by 2/3. The same trial also demonstrated the efficacy of supplemental ketones against numerous cancer cell lines and demonstrated that supplemental ketones were able to reduce lactate levels. Incredibly, this important study was almost lost to history, receiving no academic citations in the 1990s and only 2 during the 2000s. Only now are preclinical trials on exogenous ketones in cancer treatment continuing in seriousness. One mouse study with a highly metastatic cancer cell line found that ketone ester supplementation produced a longer survival than 40% caloric restriction. The control group had a survival of 31.2 days. 40% caloric restriction had a survival of 36.9 days. 1,3-butanediol, a type of exogenous ketone, had a survival of 47 days, and ketone ester supplementation had a survival of 52.8 days. This is a scan of the activity of cancer in different groups of mice. CR means 40% calorie restriction, BD means 1,3-butanediol, a ketone, KE means ketone ester. The same study also showed that exogenous ketone supplementation produced a drop in blood glucose levels equivalent to caloric restriction. Another mouse study with the same highly metastatic cell line measured the effect of the ketogenic diet with exogenous ketones and hyperbaric oxygen. The control group had a survival of 31.2 days. The ketogenic diet group had a survival of 45.1 days. The ketogenic diet and exogenous ketones combined group had a survival of 51.6 days, and the ketogenic diet, exogenous ketones, and hyperbaric oxygen group had a survival of 63.4 days. Supplemental ketones were measured head-to-head against low glucose and hyperbaric oxygen in a cell line portion of the experiment. BHB, supplemented ketones, reduced cancer cell viability by itself and synergistically with low glucose and hyperbaric oxygen. LG means low glucose. HBOT means hyperbaric oxygen therapy. Another animal model showed that ketone supplementation sensitized cancer to chemotherapy. Cell line experiments have also shown that supplemental ketones have sensitized cancer to radiation. Although there are no human trials examining the effect of ketone supplementation on cancer survival yet, there are human trials that have shown the safety and efficacy of exogenous ketones in various ailments. For instance, ketone supplementation has lowered insulin, glucose, and inflammation levels in humans. It has also shown promise in age-related cognitive decline and Alzheimer's disease. Ketone supplementation although it will temporarily raise blood ketone levels higher than a ketogenic diet, is not in and of itself ketogenic, meaning it does not bring the body any closer to being in ketosis. It does not help the liver produce its own ketones. In fact, supplemental ketones may actually slow down the transition into ketosis, although there are, to our knowledge, no human studies examining this. It seems like ketone supplementation may be of best use for people who A. choose not to attempt to enter ketosis, or B. who have been in ketosis for a while and do not have difficulty maintaining it. It may not be wise to supplement with exogenous ketones when attempting to induce ketosis. Fortunately, the most effective type of exogenous ketone, the ketone ester, is available as a dietary supplement. One company offering it is Ketone Aid. For more information on exogenous ketones during cancer treatment, see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.